Hi, everybody. My name is Isabelle Abikzer, and I'm here to present to you on a grant request proposal from ABC Children's Hospital. So what do we do at ABC Children's Hospital? ABC Children's Hospital opened in 1958. ABC Children's Hospital is located in the heart of Manhattan in New York City. Our child life department was started by a child life specialist. Her name is Tracy Green. Tracy Green grew up in Philadelphia, where she actually was able to start her own child life program in a hospital in Philadelphia. And when she heard about ABC Children's Hospital, she felt it was necessary to pick up and move to New York and start a child life department at ABC Children's Hospital. At ABC Children's Hospital, we serve patients from ages 0 to 21 years old. We are a 210-bed hospital. ABC Children's Hospital is one of the largest children's hospitals in New York City, so we serve about 1.8 million children. And because we are in the heart of Manhattan, we have patients that come from diverse backgrounds, that speak different languages, from different cultures, religions, and we do not discriminate against any patient. ABC Children's Hospital specializes in treating neonates, oncology, hematology, cardiac, and transplant patients. Those are our specialties. We do take patients with other diagnoses or illnesses, but the ones that I just named are the specialties of ABC Children's Hospital. As well, we do have one of the biggest pediatric emergency departments in New York City. Who we are. So our child life department consists of 1 full-time department leader, 3 full-time child life specialists, 1 music therapist, 1 art therapist, 2 child life interns, and 5 child life volunteers. Our 2 part-time child life interns are students from Bank Street College of Education, and they are studying to get their master's in child life. And part of the requirement of your master's is to have a child life internship. As well, our 5 child life volunteers are in charge of maintaining our playrooms and our activity centers, which I'll talk about in a little bit. But they are in charge of keeping things organized and making sure all the toys and everything is clean. So the mission of our child life department. Our child life department at ABC Children's Hospital, our goal is to meet the special needs of our patients from preemies to adolescents. We strive to reduce the negative impact that hospitalization may have on the development of our patients. As well, child life specialists offer procedural preparation, procedural accompaniment, as well as family, patient, and sibling support. Procedural accompaniment can looks like child life specialists will be in the room during a procedure, can provide distraction and help with coping techniques, and not only support the patient during this procedure, but any other family member that would be present, the child life specialist can support them as well. When a child enters the hospital, they lose their sense of autonomy and control and independence. So one of the goals of child life specialists is to provide patients with the opportunity to gain some of that control back that they lost upon hospitalization. And the way that we do that is by providing children with play opportunities, and what we do is child-centered play. So child-centered play sessions are a way for children to have complete control over these play sessions, and the child life specialist is just there to narrate and track what they're doing, but also play for a child life specialist is a window into a child's world. So through children's play, child life specialists can assess how they're coping with hospitalization and see and kind of figure out how they're doing based off of their play. Because as child life specialists, we know that play is a child's first language, and that's how they communicate. Child life specialists offer patients with opportunities for medical play as well, and this is a way to desensitize the patients for medical supplies in a non-threatening way, as well as a way to prepare them for medical procedures. So if a child, for instance, is getting blood work, a child life specialist can provide the patient with a tourniquet and the alcohol wipe and the needle if the patient does want to, and that's something that the child life specialist would do hand over hand just to be safe with the needle. And it's a way for the child to play with these items and get get like a sensory experience for what they'll go through, so they can touch the tourniquet and see that it feels like a rubber band, or they can use the alcohol wipe and see that it's cold and wet on their arm, or smell it and see that it has a very strong smell. So there's a lot of sensory experiences going on there. So this is a way for them to experience that and to desensitize themselves from these medical supplies that could be threatening and scary. And this is a way for them to desensitize themselves from it. As I mentioned before, child life specialists recognize play as a healing modality and use play to enhance optimal growth and development of the patients. So I said that the child life specialist can see how the patient is coping, but also we can build rapport with a patient through play and provide normalization and familiarization to the patient. So that's also a huge part of what child life specialists do. We try to bring normalization back into a child's day. You know, a child is taken out of their normal environment, their normal routine, and put into a hospital, which is an unfamiliar place with unfamiliar faces. They don't have structure. They don't have routine. So child life specialists strive to provide that normalization and bring it back into that child's day. Play also provides children with the opportunity for self-expression, problem-solving, self-talk, imagination, and they could do dramatic play. It's kind of like what I said before, child-centered, is that it's up to them. They're leading it. They're the ones in control. Child life specialists work hard to build trusting relationships with patients and families as a way to promote their well-being and provide family-centered care. Through assessment, education, and advocacy, our child life specialists work hard to reduce the possible negative effects a hospitalization may have on a child. So another big thing that child life specialists do is advocate on behalf of patients and families. So child life specialists are a part of the multidisciplinary team. So child life specialists have the opportunity to be a voice on behalf of the patients and families. So in rounds or team meetings, anything of that sort, the child life specialist can bring in the patient and family's opinions and be a voice on their behalf and make them feel like that they're a part of the team and they're a part of their decision-making process. So what do we provide for patients and families at ABC Children's Hospital? So ABC Children's Hospital, our child life department has designed activity centers which meet the various developmental needs of our patients and families. These rooms consist of computers, iPads, board games, arts and crafts activities. As well, we have designated areas for our patients' families, with couches and kind of like a private area for them to have, a few minutes to themselves, to make phone calls, to do work, because we do know that a lot of our patients' parents take off from work to be with their child in the hospital. But, just because your child's in the hospital, that doesn't mean that work necessarily always stops. So we want to provide our families with that opportunity to have some time for themselves to get some of their personal things done while being with their children in the hospital. So as well, we offer pet therapy, horticulture therapy, knitting programs, yoga programs, Me TV programs, and scrapbooking and video journaling programs. All of these programs are open to our patients and families. Our yoga programs and knitting programs and scrapbooking and video journaling programs all take place after 5 p.m. So we do that because sometimes we find that parents do still go to work, but come after work to be with their children in the hospital, and we want to provide activities for patients to do with their parents if their parents are not here for the day. So we have that at the end of the day. But the Me TV programs, pet therapy, that all takes place during the day. So if we do have patients that are alone without their parents, that they have those things to occupy them. As well, we try to be culturally sensitive and aware, so we do so by celebrating all the holidays celebrated by our patients and families. We try to ask each patient and family what holidays they do celebrate, if there are any holidays coming up for them, so that we can be aware of that and we can provide them with the proper things to celebrate. Our child life department decorates the hospital during holiday season. We bring in celebrities to come and celebrate and bring gifts to our patients. And once a month, our child life department holds parent support groups for our parents of our past and present patients. So not only the present patients that we have at the hospital are allowed to come, but past parents of patients in our hospital can come as well. These meetings last for 1 hour with refreshments served afterwards, allowing the parents time to talk amongst themselves after group and connect with one another. As well, every Monday, we receive visits from clowns from the Big Apple Circus who come to put a smile on each and every one of our patients' faces. As well, we receive volunteers from Hole in the Wall Game Camp who come once a week to provide bedside services to our patients who cannot leave their rooms. So for our patients who cannot come into our playroom if they are on contact or for any other reason they can't come into our playroom, Hole in the Wall Game Camp comes and provides bedside services for those patients. So what do we need? We have as I mentioned, one of the biggest pediatric emergency departments in New York City. And you know, I went through before what child life is and the importance of it, what we can provide. And we feel very strongly that we need a child life specialist to cover our emergency department. You know, the emergency department is a fast-paced environment. It's scary. It's loud. There's people running, there's voices, there's machines going off. There's a lot going on. And for a scared family and scared patient who are coming into the ED who have absolutely no idea what's wrong, what their journey is going to look like, we feel that they need that support. And this is an extremely scary time for patients and families. And if a patient comes in and they quickly need an IV, our child life specialist can be there, quickly prep them, or help with coping techniques, help with distraction, help narrate what's going on during the IV placement so that the patient is not surprised by anything and they know exactly what's going on. As I mentioned before, the child life specialist can provide some of the medical supplies that will be used during the IV to help desensitize that patient. As well, the child life specialist can be a support for the parents and explain to them, you know, be a mediator between the families and the doctors, and just help support them during this extremely scary and traumatic time. So we are requesting a grant to fund a position in our emergency department, a request of $85,000 to fund this position. The hours and days of our child life specialist would be Monday through Thursday, 6 p.m. to 2 a.m., and then Sunday, 3 p.m. to 11 p.m. Now, these hours do sound a little bit different. They're not your typical 9-to-5 job, but we feel that that these are the proper times that a child life specialist would be able to support our patients and families. You know, if, for instance, you have a child who's sleeping and wakes up in the middle of the night and something's wrong, and they come to the emergency department, there's somebody there. There's a child life specialist there that's able to support them and help them through that time. So we are requesting a grant for $85,000 to fund this position. So how we will evaluate this position. We will evaluate the effectiveness of our child life specialist by having families fill out a survey asking them how they perceived our child life services. As well, we will also leave space for any recommendations as to how we can provide more effective services or provide better patient and family-centered care. So we want to hear back from the families. What can we do for you? How can we help you? You know, from our child life department, from our point of view, we feel that by the child life specialist being there, helping support with procedural support and distraction and coping techniques and family support, that's how we feel that we can help these patients and families. But we want to hear from them. What can we do more? What can we do better? We want to hear it from them. So we're leaving space for them to have a voice and for them to participate in making this position the most effective it can be. As well, the child life specialist will have a statistics sheet in which he or she will need to fill out each day. So this is tracking the activity that's done during each shift. And this sheet will include preparation, procedural accompaniment, medical play, therapeutic activity, family support, chart note, staff meeting, in-service attended, and foundations of program. As well, there will be room on that sheet for the child life specialist to add in anything that doesn't fit into any of those categories. But we just really want to see how the effectiveness of their work, how they are supporting families and patients, and kind of just track what they're doing throughout the day and how they are helping in the emergency department. Thank you so much for your time and consideration. If you have any other questions or comments, please feel free to reach out to me, Isabelle Abikzer, Child Life Specialist, and my number is 516-555-5555, extension 111. Thank you so much.